and welcome to the Friday, June 5th edition of the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. I'm showing off my new t-shirt today, and I am here with Dr. Stuart Kennedy, who is Incident Manager. Dr. Kennedy, we're looking for an update as a result of the recent exposure or potential exposure incident. Patients and staff were tested for COVID-19. What are the results?
Certainly, Tracy, and I'm just hoping in another little while we can change the direction on your t-shirt that says COVID-19 conquered.
Past tense.
So that's my goal.
Absolutely, I agree.
So we've had really good results from all our testing. At this point in time, all the 26 patients that had contact with this particular physician has been tested as negative, and they will be re-swabbed and retested in 14 days past exposure. Also, the additional 8 patients that had some contacts with other contacts have all come back as negative. And staff, all the staff, over 140 have been tested. Some results are just trickling in, but well over 95% of those 140 have come back testing negative. So we are really in good shape, and as what we expected that this was a low risk based on the science that we had discussed with our chief medical microbiologist and Dr. Gamble, but certainly we had to do all due diligence to make sure we did not have any type of influx of COVID-19 or hospital spread in Thunder Regional Hospital. So that's very rewarding, and that's why you're going to ask me in a little while when we're going to get back to normal.
Right, absolutely. Now, you mentioned about 95% of the tests on staff who had potential contact were back as negative. Does that mean the other 5% are outstanding and all of those results received so far are negative? There's no positives is what
There's no positive, and we're still just waiting for a few to come back in to confirm the negativity.
That's fantastic.
And also at the same time, we did the surveillance swabbing of all, the employees here at Thunder Regional Hospital, and certainly we've sent them to Toronto for assessment. But again, the surveillance swabbing, they've all come back as negative also, but we have a great deal outstanding. And I think, Tracy, last count, we were doing over about 900 of our staff, so that's outstanding, but we don't have a lot of those results back yet.
Great, and we'll add more numbers today, too.
Yes,
Good.
yes.
So there has been a lot of reflection regarding this incident. What lessons would you say have been learned, and what are the next steps?
Wow, I mean, certainly, Tracy, everybody has an opinion on this, and I think the opinion stems around the anxiety with our staff and community members, and certainly, but we at the IMS and myself base our opinion on science and fact. So we try to not to get ahead of the science and fact, even though there's a lot of anger out there, there's a lot of disappointment out there, which we understand. But we make a decision here based on fair process, due process, and an investigation. We're not covering anything up here. We certainly realize there was a major event here at Thunder Regional Hospital. So far, we have avoided any major impact besides the cancellation of surgery, which certainly is major, but we can't jump to conclusions. We have appointed a subcommittee of the Medical Advisory Committee. A number of individuals will be doing an investigation, and they will report the investigation to the Medical Advisory Committee. That will then report to the board of directors, and then further action, if required, will take place. But every employee, not only a physician, a nurse, a housekeeper, when there is a difficult event or a crisis, they all deserve the ability to have a fair and due process. And that's what we're going to follow, and we'll continue to follow. And I do realize there's lots of people, individuals that say we should have been more quickly to act on this individual physicians, but I'll treat every physician, every employee the same way. They deserve a fair process, a due process, and that's what we're doing.
So are there learnings that we're able to implement prior to any investigation results?
Yes, we have to work really quickly to make sure we do not have a similar occurrence. And certainly at this point in time, we will test every outside worker from Northwestern Ontario prior to beginning sort of a stint here at Thunder Regional Hospital. We still need physicians who practice out of town to come and support the medical staff here and actually assist patients in Northwestern Ontario and Thunder Bay. So we still need those physicians and other healthcare workers, so we are not going to eliminate them, but certainly they're going to be screened and also they'll be tested prior to being able to work here at Thunder Regional Hospital.
And that's something that we're able to implement immediately now that there is more capacity for rapid result tests here locally.
Yes, this will be a priority test. We'll get results very quickly, and they certainly will be able to sort of have their test and able to, if it's negative, continue on working here.
That's great news. Okay, thank you, Dr. Kennedy. So related to this incident, out of precaution, the decision was made to postpone the non-essential and elective services, including elective surgeries, that had been scheduled to resume this week. What is the status of that decision given the results and the new information?
Yes, I mean, to date, that has been the largest, most disturbing result of this unfortunate incident. And we had to make that decision quite quickly on Sunday evening to protect the health and the safety of both our patients as well as our staff. But I'm glad to say, because we have the vast majority of test results back, that we do not have to wait for the 14-day other test to come back, because the virus and the low risk of this individual was so low that we need to actually move on and begin to increase our volume of surgery, elective surgery, and we're going to reinitiate that on Tuesday, June the 9th, and that's going to be our outpatient procedures. That includes diagnostics, our surgery, and certainly patients will be contacted by the physicians based on their priority, but we are going to resume elective procedures on June the 9th, this Tuesday, and staff has been informed to begin making those arrangements. Just plead to the patients, do not call here, you will get a call from us. But this actually is good news. Again, it's just a 25% increase in volume. We have a recovery team working on next steps, and when do we go to the 50% recovery and when we go to 100% recovery, and we're working on that. But we're going to begin beginning the slow incremental increase in elective surgery on Tuesday, June the 9th, and we're very, very happy with that.
Yes, I think a lot of people will be. That's great news. Now, what does this mean for essential care partners? Because over the past week, we had to restrict essential care partners even due to the unknown risk in the hospital.
So we're going to reinstitute the essential care partner policy that we had to abruptly take away last Sunday. But still, just essential care partners will be allowed in Thunder Regional Hospital, but it won't be as restrictive as it had starting on Sunday. So, which is again good news. We need to actually further the ability to provide compassionate, family-centered care here at Thunder Regional Hospital.
Okay, thank you. And lastly, the decisions that are made regarding the resumption of services, including who gets scheduled for a elective surgery or a non-essential service, how are those decisions made, and who determines which patients go first?
First off, it's determined by the capacity we have here at Thunder Regional Hospital. So we have to always look at our bed capacity and what type of procedures will preserve some of our bed capacity. It'll be based on the urgency of the surgery. I mean, even though it's elective surgery, some elective surgery have a higher priority than others. But that would be a decision between the patient and the physician to see what patients they're going to be bringing in for their procedures. And it'll be monitored on a weekly basis. And we have to look at our PPE supply. We have to look at our drug supply. We got to look at our human resources availability. It'll be a whole monitoring system that we'll be checking each and every day, but making decisions each and every week where we go next with an increase in volume of services. Because we know, I mean, the difficulty patients are having out there. And this incident also, I think, made our community members even more afraid to come into the hospital. So, but I must say, we are in better shape now than we were on June the 1st when we had to sort of de-escalate our services provision. So from my perspective, we learned from this. We'll continue to learn from this. As I said from the very beginning of our sort of interviews, this is a learning process. This is a roller coaster. This is not going to be the only disappointment we have, but we need to begin to look at the risk we're able to take, as well as the community members are able to take, and as well as patients are able to take during this COVID-19 crisis. And it's all about risk assessment, and certainly because it's going to be with us for quite some time, and we want to continue to keep patients safe, staff safe, but there's always those unpredictable events that are going to continue to occur. And that's why we have to, when we make decisions, we have to make decisions on risk assessment. The patient at home suffering versus how we protect our staff and how we protect our patients here at Thunder Region Hospital.
Right. Well, it's an important reminder. We are still in an active pandemic. We need to respond accordingly and responsibly. So
yes.
Thank you very much, Dr. Kennedy. Thank you. We'll see you soon.